Hey everybody, this is Beth Durinsky from Odyssey Insurance and Investments, and you're listening to the podcast, Real Insurance Made Simple. As a working mom of young kids and a small business owner, I know firsthand life happens. So come along with me and learn how your insurance policies work when real life happens and you need them most. Hi friends, welcome to another episode of Real Insurance Made Simple. We are still in our Medicare mini-series, and this week we are kind of going to do a very quick this or that episode as it relates to this is Medicare, that is Advantage, otherwise known as Part C. Just a quick recap, last week's episode was on supplements. We have already hit previously on Part A, Part B, Part C. Next week is going to be the interview that we completed with Brooke, who is a local nursing home director, and how your Medicare supplement works within a nursing home, which is super informative because that is one of the most confusing aspects of how your Medicare works when that time comes. When people don't need it or don't use it, of course, that part doesn't get confusing because you don't mess with it. But when the time comes, it seems to get very convoluted. So be on the lookout for that next week. So without further ado, let's go ahead and hop into this. Like I said, it is going to be a very quick this or that. I am hoping to keep this under 5 minutes today. Let's see if I can do it. Okay, so networks for a Medicare supplement. There are no network requirements for a Medicare supplement. As long as your provider accepts Medicare, they will accept your supplement. A Medicare Advantage. Typically, the PPO and HMO plans include networks, and HMOs mean in-network only usually, and PPOs give you a little flexibility, but you're going to have that better coverage, better copays if you stay in-network. Okay, let's see what we got next. Going down the list here. Prescription drug coverage is not included in a Medicare supplement. You will have to purchase a separate standalone prescription drug policy with your Medicare supplement plan. However, most Medicare Advantage, not all, there's always some exceptions. Again, check with your local agent, but most Medicare Advantage plans will also include that Part D coverage for your prescriptions at the pharmacy. Doctors and hospitals are the next on the list, so you can choose your own doctor and hospital as long as they're Medicare approved, whereas that is on a supplement. I should have clarified that. Whereas on the Advantage plan, you do typically want to stay in network, and some plans may require you to stay in network to get coverage at all. It depends on the type of Advantage plan that you choose. For specialists on a supplement, no referrals are necessary, but on an Advantage plan, referrals may be required. Again, it depends on the type of Advantage plan you choose. The enrollment periods. All right, for Medicare supplement, you have your 6-month Medigap open enrollment period, which does start on your 65th birth month. And then afterwards, your Medigap enrollment is subject to medical underwriting. Go back to the Medicare supplement Medigap episode to get more information on what that means. But the enrollment period in general for a supplement or Medigap is 6 months, which starts on your 65th birth month. However, for an Advantage plan, you have different enrollment periods throughout the year that are more specific to certain things. You have things called IEP, which is your initial enrollment period, your MAOEP, which is the Medicare Advantage open enrollment period, or the Medicare AEP, which is the Medicare annual enrollment period. For example, the AEP is what we're most familiar with. Well, what most clients are familiar with, which is between the October 15th and December 7th, which allows you to enroll or switch plans. Again, for more specifics on this, go ahead and reach out to that local agent or give us a call and we'd be happy to help walk you through that. Okay, about halfway through my list and realize I'm not going to hit the 5-minute mark, but that's okay. We're moving along nicely. The next on the list is going to be cost. Regardless of which option you choose, the supplement or the advantage side of the fence, you have to pay your Part B premium. Again, there are different factors that come into what that Part B premium looks like for you. I would encourage you to go back and look at the previous episodes on that. Medicare supplement plan premiums are set by the carrier, and they do have a monthly plan premium. However, on the Advantage side, you could get a premium as low as $0 per month, or it could be higher. I'm going to sound like a broken record, but again, go ahead and reach out to your local agent for clarification on those cost differences. Okay, so next on the list is going to be your out-of-pocket maximums. For the supplement side, generally, there are no out-of-pocket maximums. Only Plan K and L have those. However, on a Medicare Advantage plan, almost every plan has an out-of-pocket maximum, and it can be as high as approximately $7,000, and that was as of 2022. Those are in-network numbers. You'll want to reach out to your agent to see what the updated numbers are for 2024, and usually out-of-network is higher than in-network for that out-of-pocket maximum. Okay, so vision, dental, and hearing is one that we always get asked about, or any additional benefits. Your Medicare supplement does not cover routine eye exams or eyeglasses, routine dental exams, cleaning or x-rays, routine hearing tests, or hearing aids. So for your routine vision, dental, and hearing, your supplement does not cover that, nor does it have any additional benefits outside of what Medicare covers. On the flip side, with the Part C Advantage plan, some plans, not all, you'll want to check your plan and with your agent, offer additional benefits like the eye exams, glasses or corrective lenses, dental exams, cleanings, x-rays, hearing tests, hearing aids. And in addition to that, they may offer, again, depends on the plan, they may offer additional benefits like fitness and wellness programs, transportation services, home modification, maintenance, telehealth, and a few other things. So check with your agent on what that looks like and what benefits you may be able, see what words am I looking for today? They're apparently hard. What benefits you are eligible for based on your plan. Okay, we are down to the last two things on the list, and that is pre-existing conditions and quality or star ratings. So pre-existing conditions on that supplement, as long as you are in your Medigap open enrollment period, you have what's called a guaranteed issue, and they don't look at your pre-existing conditions. However, after that period, you may have to answer underwriting questions based on your health, which will impact your eligibility at that point in time, or it could. Whereas on an Advantage plan, you can always join a Medicare Advantage plan, even if you have pre-existing conditions, as long as you join within those enrollment periods, like the IEP, OEP, or AEP that we previously discussed. Finally, Medicare supplement plans do not receive ratings, otherwise known as star ratings, from Medicare, whereas the Part C side of the fence are rated on a 5-star system by Medicare, and lots of things come into play with that, like patient experience, quality, and this is all factored in when people call and they make complaints or they don't make complaints on the plan or the doctors in the plan. It can be based off of network, how claims are paid, service, all kinds of stuff. But anyways, they're on a 5-star system, and you can review your Medicare Advantage plan based on the 5-star system on how it ranks compared to others in your area. That is my quick this or that episode for the Medicare mini series on supplements in comparison to Advantage plan. Again, this is not all inclusive. This is a very quick, how does this one work versus how does that one work? So please, I encourage you to reach out to your local agent or give us a call at the office for more information at 812-932-2200. We hope you guys have a blessed rest of your week. Bye, friends. Thank you all for listening today. We hope you found this episode helpful and informative as you navigate the world of insurance. As a reminder, this podcast is never for legal or professional advice, and you should always consult your local and licensed insurance professional. We wish you a week filled with love and blessings from the team at Odyssey Insurance and Investment.